Joe, thank you very much, and thank you for your great leadership at Mercy through all these years. You and Carmela Brown, thank you for being just wonderful friends and great community leaders here in terms of health care. I do go back a long way with Mercy. I've told the story many times about how my father used to come into Mercy almost every year when he was older. Of course, it was before we had Medicare, and he had been mining coal for most of his life, so he had that black lung disease. He had some injuries. Well, of course, he did some other things that weren't too good. He smoked and drank a lot, too. But every year he'd kind of get really sick, and we'd have to rush him into Mercy from out in the country. We didn't have any money. We just didn't have any money. And the nuns here would always take care of him. Get him back into health and send him back home. It just happened like every year, just like clockwork. I can remember coming home from the military one day, 1965. This is just 2 years before my father passed away. He was still pretty healthy, living at home, and he showed me his Medicare card. And now he could get Medicare. He didn't have to rely upon charity any longer. But I remember the way the nuns here and the way that Mercy took care of him, and I owe a great debt. And Joe asked me if I was born here, and I said, well, no, I really wasn't born here. I was born at home. Now, just looking at this new neonatal unit here and all the wonderful things they have to take care of babies, I told Joe it's true. When I was born in 1939 at home, almost everyone, all my relatives, everybody out there was born at home. And the story was told to me later, and I think it was probably true. If you lived a couple of weeks, then the doctor would come around and check you out. If you didn't live 2 weeks, well, then he didn't have to waste his time. And a lot of babies, I had a lot of stillbirths in my family, or kids that were born and then died right away. A lot of babies were born and died in childbirth. So we've come a long way since those days. To see what they do here with premature babies who in those days would never have had a chance. Never have ever had a chance. So anyway, a lot of good connections. Although I do have one little story about Mercy that has to do with interpretive services. I came up here again. They took great care of my brother Frank, who was deaf. And I came up to visit Frank once when he was hospitalized before he passed away. And I remember he was in his room, and I came to see him. And he was complaining to me about something. I said, what's the problem? He said, well, he had this button that he would push to summon a nurse. But she wouldn't come. I said, push it again. So he pushed it, and then I heard over the loudspeaker come, yes, can I help you? You need some help. And of course, when no one responded, they probably just thought he was accidentally leaving on the thing. So I immediately complained, and they put lights up, and it's all been taken care of. So it's just one of those things. But thank you very much, Joe, for taking care of that, for making sure we have good interpretive services and take care of people with disabilities. There's a happy ending to that story. Well, that was not what I was here to talk about. I'm here to talk about the S-CHIP program, the Children's Health Insurance Program. As you know, last week the Senate reauthorized it, and the good news is we did it with a strong bipartisan vote of 68 to 31, which means it's veto, which means we would have the votes to override a veto, which the President of the city is going to do. Since we first created this program over a decade ago, it's been an extraordinary success, providing basic health insurance to 6.6 million children whose parents could not afford private insurance, but who were just above the line of qualifying for Medicaid. In Iowa, of course, we call it the Hawkeye program. It has been a godsend for our state. It's brought health insurance to nearly 50,000 Iowa kids. It's been the driving force in reducing the number of uninsured low-income children in Iowa by a third. And one of those children was with us here this morning, actually. I don't know about. I only know about one because I talked about her on the floor of the Senate just last week. And I had her picture there with her mother, and that's Jen C. Ruff, and her family, that's Graham, and her mother Marcy. I hadn't met Graham till now, but I recognized her mother, Jessie, but I had a picture of her. I blew it up, and I had it in the Senate floor to talk about her. You know, surely in a humane, decent society, no child should go uninsured without health care. No child should go without regular checkups and prompt treatment of injuries and illnesses. It's just incomprehensible to me that the President vetoed the bill because it's going to extend coverage to more children. Instead, he has proposed only $4.8 billion in additional funding over 5 years. That's even less than it would take to maintain current enrollment. The President's proposed funding would cut 1.4 million children and pregnant women from the Children's Health Insurance Program. So we faced not just a public policy choice, I think, but a very basic moral choice. Do we go forward and extend health insurance to more children from low-income families? Or do we cut these children from the rolls and condemn them to a childhood without checkups, without health care, without necessary medical treatment? That is, until they show up in the emergency room sometime later on. So the Senate bill would extend coverage to more than 3 million more low-income uninsured children over the next 5 years, about another 15,000 here in the state of Iowa. Now, people are saying maybe we can't afford it. Well, I'm sorry. We are spending $10 million. Scratch that. Even I can't get hold of the figures. We are spending $10 billion a month in Iraq. $10 billion a month. And the President is saying that we can only afford $1 billion a year for the Children's Health Insurance Program. He's threatening a veto because of that, because we went over that. Well, this is wrong. I don't think it reflects the priorities, values, and compassion of our Iowa people and of the American people. According to a recent poll, 9 in 10 Americans support expanding the Children's Health Insurance Program. Large majorities in both the House and the Senate have agreed to put aside partisanship and ideology and pass this important bill. So I urge the President to do the same and to reconsider an ill-advised veto threat. So we value the Hawkeye program here in Iowa. We appreciate that children like Jency have access to checkups and other medical care. And we're not going to stand for her or her brother Grant being cut from the rolls of the Hawkeye program. We're simply not going to go backward in this. Again, let me just point out that it's been said by a number of people, well, these people ought to negotiate. They ought to be in private insurance and they can negotiate private insurance. I was listening to the debate last week on the Senate floor, and I was in the cloakroom, and I saw Senator Lincoln from Arkansas, who's the head of our rural caucus. Listening to the senator go on and on about they should be negotiating. We shouldn't take away their right to be able to negotiate with private insurance companies. I said to Lance Lincoln, I said, negotiate? They got the wherewithal to negotiate? She says, yeah, they're working 2 or 3 jobs. They got 2 to 3 kids at home. They can barely keep body and soul together, but they're supposed to go out and negotiate for a good health insurance. This is nonsense. What we're trying to do is to, again, make sure that these kids get the health insurance they need. Again, as Jency, as her mother can tell you, so they get the regular checkups. We had the case last year in Washington. I spoke about DeMonte also. As a contrast with Jency, I spoke about DeMonte. DeMonte was a young kid in Washington that had an abscessed tooth. No health care insurance. Mother was just, again, above the Medicaid line working. Couldn't afford insurance. So she didn't take him to see a doctor. It got worse and worse. Finally rushed him to the emergency room. By that time, the virus had spread to the brain. They had done all they could to save him, but in 2 weeks he died. All because of an abscessed tooth. Now, something like this should not happen in our society. So that's why I feel so passionate about the Children's Health Insurance Program, why we need to expand.